Man,
Hi, my name is Brittany. I'll be your nurse today. What brings you in?
just here for a wellness visit.
Great. Can I see your wristband, please? First and last name and date of birth?
Kayla Perry, 3292,
Great. And do you know what today's date is?
July 27th, 8th,
Good. And where are we?
Coventry.
Perfect. So the patient appears alert and oriented ×3 to person, place, and time. Skin is normal coloring, features are symmetrical, and she doesn't appear to be in any distress. Are you in any pain today?
No.
Good. If you had to rate your pain on a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain you've ever been in, what do you rate your pain?
0.
Awesome. So today we're just going to do a quick head-to-toe assessment. Let me know if anything feels funny or if there's any discomfort as we go through.
Okay.
So I'm just going to start with your head. I'm going to feel around. Good. So the scalp is intact. There doesn't appear to be any skin lesions or bruises on the scalp. The hair is full and it is smooth and not wiry or brittle. I'm also going to feel your ears. And do you have any pain or discomfort as I did those? Tenderness?
No.
Good. And when I touched your head, was there any pain or tenderness?
No.
Good. So now I'm just going to assess your lymph nodes. If you don't mind turning this way. All right. So I'm going to start with the occipital lymph nodes. And then the postauricular, the preauricular, the parotid, the tonsillar, the submandibular, and the segmental, the anterior cervical, posterior cervical, and supraclavicular lymph nodes. Good. So was there any pain or tenderness as I palpated those?
No.
Awesome. So you can go ahead and spin back around. I'm now going to place my hands on your shoulder. Can you lift up for me? Good. Was there any numbness or tingling when I did that?
No.
Great. So the shoulders are bilaterally strong, and now I'm going to assess your arms. Okay. Did you have full sensation as I moved down your arm?
Yes.
The skin appears to be intact. There's no bruising, and the coloring is appropriate. I'm now going to check your capillary refill. Good. And good. So capillary refill is good on both sides, less than 3 seconds, so that's a normal finding. There's good perfusion to the arms. I'm going to check your radial pulses now. Good. So radial pulses are strong bilaterally. I'm now going to test your strength, so go ahead and take my hands, give them a squeeze, and now pull towards you and push it back. Good. So the upper extremities are equally strong, and I'm now going to do the Perla exam. Okay. So just keep looking at me, and I'm going to take a look at those pupils. All right. So right now they're about a 5, and just keep looking forward. I'm going to shine some light in your eye. So the pupils are equal, round, and reactive to light. They accommodated from a 5 down to about a 3, and that occurred equally in both eyes. So that's good. I'm now going to assess your cardinal fields of gaze. So just look at the pen and follow it with your eyes without moving your head. So the eyes moved equally on both sides, and there was no jerkiness or shaking as I moved my pen light, and both eyes there was no involuntary eye movement, so that's good. I'm now going to do the corneal light reflex, so just go ahead and keep looking straight and try not to look at the light. Good. So the light reflected equally in both pupils. Sorry, equally in both pupils, and that's a normal finding. Oh, I'm now going to check your mouth, so just go ahead and open your mouth and say ah and stick out your tongue. Perfect. So both the hard and soft palates are intact. The mucous membranes are pink and moist. There are no dental findings of cavities or dentures, and there's no thrush or any redness in the back of the throat. I'm going to now move on to Actually, also in the patient's face there's no facial droop. It's symmetrical bilaterally, and the patient is alert and oriented and speaking clearly without any slurring and follows commands. So I'm going to do that cardiac exam now. First I'll start by palpating your carotid artery. Good. So the carotid arteries are strung bilaterally, and I'll now take a listen to those. So actually I'm going to have you take a deep breath in and hold it when I place my stethoscope. And you can let the breath out, and again. Perfect. So there's no whooshing or turbulent blood flow. There are no bruits or murmurs. So now I'm going to move down to the heart valves. Okay. So I'm going to start with the aortic valve. This is of the second intercostal space of the right sternal border. S2 is louder than S1. Moving over to the pulmonic valve, second intercostal space of the left sternal border. S2 is louder than S1. Down to the Erb's point at the third intercostal space of the left sternal border. S1 and S2 are equal. Down to the tricuspid valve at the fourth intercostal space of the left sternal border. S1 is louder than S2. And then over to the mitral valve at the fifth intercostal space of the midclavicular line. S1 is also louder than S2. Good. While I'm here, I'm just going to palpate that apical pulse. Good. I'm going to listen and simultaneously palpate the carotid artery. Good. So they're equally strong, and there's no pulse deficit, which is a normal finding. I'm going to switch over to the valve of my stethoscope and listen to those same valves. Great. So no whooshing or turbulent blood flow, murmurs or bruits for those cardiac valves. I'll now do the respiratory assessment. So just whenever I place my stethoscope, take a big deep breath in and out. Okay. Good. So the bronchial field, expiration is louder than inspiration. Moving down to the bronchovesicular region. Good. Here, inspiration and expiration are equal. Moving down. Okay. And at the vesicular region, inspiration is louder than expiration. I'll move to the the lateral lung fields. Good. And now I'll do the other side. So long sounds are clear, unlabored, and regular on both sides. I'll now move to the back. Okay, so same thing when I place my stethoscope, deep breaths in. And last one. Good. So same in the back. Respirations are clear, unlabored, and regular on both sides. I'm now going to do respiratory expansion. So give me a big deep breath in. Good. So the chest expanded equally on both sides, and it was smooth movement. Check CVA tenderness now. Good. So was there any pain or tenderness when I did that?
No.
Awesome. So the kidneys are not inflamed, and that's a good sign. So now you can spin around. Okay. So now we're gonna take a seat. Okay. Right. No, you're good. So to begin, the patient's abdomen doesn't appear to have any masses. The skin is of normal coloring. There's no bruises or observable masses. So I'm going to begin by listening to the 4 quadrants of your abdomen and listen for some bowel sounds.
Okay.
Good. So there were bowel sounds present in all 4 quadrants. Do you have any problems going to the bathroom?
No.
Great. Awesome. So now I'm going to listen to the arteries of your abdomen. So I'm going to start with the aortic artery, moving down to the renal artery. Good. The iliac artery. And the femoral artery. Great, so there were no murmurs or bruits or turbulent blood flow in those areas. I'm now just going to palpate your abdomen. Let me know if you feel any pain or tenderness as I go through.
Okay.
Any pain? Oh, great. So now I'm just going to move down to your lower extremities. So just let me know.
Is that good?
Yeah, good. Good. So did you have full sensation all the way down?
Yes.
And then I would just take a look at the skin. So there's no edema, skin coloring's normal, no bruising. All right, I'm going to check those pedal pulses. So I'm going to start with the dorsalis pedis. Good. So both pulses are equal and strong bilaterally. Now I'm going to move on to the posterior tibialis. Good, and those are strong and equal bilaterally as well. Okay, so I'm going to test your strength. So go ahead and push up on my hands. Perfect. And now push down. Awesome. Lower extremities are equal bilaterally. And strong and equal bilaterally. I'm now going to check capillary refill. Good. Capillary refill is less than 3 seconds bilaterally, indicating good perfusion down to the lower extremities. And last but not least, the patellar reflex. Don't mind spinning. I will use my stethoscope. Good. And good. So those are both reactive. So that concludes our head to toe. Do you have any questions?
Nope.
All right. Have a good rest of your day.
Thanks.